And it is time for building a roll. Well, whew.
You're just laughing because I'm over here listening to that disclosure, and I'm exhausted.
Yeah, there's a lot to disclose.
I'm like, good grief.
That's
a lot.
Denise Miller with us. How are you, Denise?
I'm good. Good morning.
Amy Shipley with us. Amy, how are you?
Hi, I'm very good.
When we're talking about Medicare, Medicaid, with time to sign up, enrollment period, what is this? Parts A, B, C, D.
Don't you want to just turn the television off?
I'm like, I got to watch something other than Andy Griffith.
Gosh.
Because it's all over Andy Griffith.
So
why does it feel so hard to make these decisions?
Well,
What's my challenge?
The challenge is the jargon. You know, there's so many letters.
Mm-hmm.
You know, oh my gosh, Part A, Part B, Part C, Part D. But honestly, don't make it harder than it has to be. If you are on Medicare, you should have Part A for sure. Mm-hmm. Some people never turn Part B on, and that's fine because you pay for Part B.
Okay.
But if you want a Medicare supplement or a Advantage plan, you kind of need to have the Part B with it.
Let's break this down, Amy. So let's go kind of to the Medicare basics.
Okay, sure.
So, help me understand.
Okay, the A, B, C's, D's.
The A, B, C's,
Medicare.
D's, F's,
Sure.
Advantage, and supplements.
Okay.
Yes.
So, well, just first off, basically, Medicare is something you can sign up for when you turn 65. Mm-hmm. Okay, so you've got, I think, 3 months before you turn 65, the month of your 65th birthday, and 3 months after. So that's your that's your time to sign up for it. And you don't need to have an insurance agent to do it. You can actually just go to Medicare.gov, and they have a simple button right there that says enroll, and you can sign up for yourself.
Okay.
So that's when you turn 65, you turn on Part A.
Okay.
Part A is for hospital coverage. And it's paid for by working, throughout your life. And what you'll have to do to qualify for Part A is be eligible for Social Security benefits, which means you've had at least about 10 years of work where you've put money into the system.
Okay.
So if you look on your pay stub, like I did this morning, I have a little line that says taxes, and that's where my nice gross salary goes down to what I actually get in my account, right?
Yes.
Down.
That's another story. That's a whole other program.
Yeah.
Yep. There's a line that says Medicare, and there's a line that says Social Security. So you're paying into Medicare out throughout your life. That's what pays for Part A.
Okay.
So they say Part A is free. Well, Part A is what you've paid for during your working years. Mm-hmm. Okay? And then there comes Part B. And that's for your doctor's visits, your outpatient therapies, your x-rays, labs, anything that's outside of the hospital. And this has a premium cost to it. And you pay, in 2026, it's about $206.50 a month, or about $2,500 a year. Mm-hmm. Then what Denise is selling is your Medigap policies or Medicare supplement policies, and that covers what Parts A and B don't. So there's some co-insurance, there's some deductibles, co-payments, things like that. And then Part D is your prescription drug plan. Mm-hmm. So that pays for all of your prescriptions. And then what Part C does is it's an alternative to traditional Medicare, and it's a private insurance company that's managing these Medicare benefits for you. So you do have Parts A and B when you're on Medicare Part C, but it's just more like a management company that's managing your benefits for you.
Okay.
So yes, trying to figure all of this out at once, boy, it can be really overwhelming. It can be discouraging. Trying to pick plans based on premiums, or coverages, or what doctors are in or out of networks can be really confusing. So that's why it's good to just take it step by step, one person at one layer at a time. Talk to us. We'd be happy to kind of walk you through the A, B, C's, D's of Medicare and supplements just to give you a good understanding of it. And then another thing I want to point out, I had a question the other day. So, do I need to sign up for Medicare every year? Somebody told me I did. No, you don't. You can sign up once for Medicare A, B, and your supplement and your drug plan, and you can never change it. If you're happy with the way it is, you're getting the coverage you like, set it and forget it.
Mm-hmm.
If you want to look at maybe a different prescription plan, an Advantage plan, then you have the open enrollment period, which is right now, that you can do that.
Okay.
Okay?
All right.
Yeah.
So what about the workplace and the marketplace benefits? Kind of touched on that just a little bit earlier, Denise. What's going on there?
So under age 65, to get your health insurance, if you're not covered by a group plan, you have to go through the marketplace. And right now, even that is a little unsteady, or I don't know, unsure, or maybe that's not really, it's unknown. Maybe that's a better way to put that, about how those plans are all going to shake out. But honestly, it's a time that you need to be aware of all of your different options. And, you know, I'll even throw out that there's dental and there's vision riders as well, you know, so you can pick up a dental policy or you can pick up a vision policy, and that's especially true with group health, and it's especially true in the marketplace as well. You can tack those things on. You know, you have to basically weigh your decisions about, is it worth it? Mm-hmm. And, you know, I say this, if you come and talk to me about dental insurance, I'm going to say the same. I say this I'm like a broken record. I have a love-hate relationship with it. Because, yes, it's insurance, but then the next thing is, who's in network? Who takes dental insurance?
Right.
Do you take this dental insurance? Because your dentist may accept dental insurance, but they may not take Delta Dental of Iowa, or they may not take, you know, the Blue Dental program. You know, there's all kinds of dental insurances out there, but not every provider is in network. So again,
you have to be careful.
Be careful of that.
Yep.
And the same with vision. Well, this eye doctor may only take this brand, and this eye doctor only takes this brand. So again, you need to just know who you want to go to the doctor with, what network are they in, do they take this insurance, how much is it going to pay for itself or not? So it's easy to get overwhelmed, and it's easy to just default to what you did last year, you know, and you just really need to review your needs. Look at your family, look at what's going on, the amount of times you've been to the doctor, the prescriptions, and you may be able to save some money. You may be able to improve your coverage, but, you know, if you spend a few minutes comparing and trying to dissect it, talking to your HR person, talking to a qualified agent, these small details can, you know, I go back to Dan Miller, small hinges swing big doors.
So if someone walks in and they're completely overwhelmed and they sit down and say, Denise, help me, and then you walk through this, do they feel better?
I just had somebody last week come in and they were like, what? I have they bring in this 3-inch stack of mail and set it on my desk, and they're like, what? I don't know what. And I'm like, okay, relax, you know. Mm-hmm. And we went through it step by step. They threw I shredded the 3-inch stack of mail they had. And when we got all done, they were like, boy, am I glad I came to you. This wasn't near as bad as I thought it was going to be.
See? Have the conversation, ask the questions.
Don't be afraid to ask questions, you know, and we're happy to go through a 3-inch stack of mail because honestly, it was a lot of advertisements. Yeah. So,
are there other challenges in living right here in rural America, Amy?
Yeah, there can be. There's a lot of benefits to living here in rural America too.
I think a lot of it.
You're right. It's a little bit of a challenge when there are fewer provider networks, like Denise had mentioned. There's more in an urban area than we have in our rural areas. You know, there can be travel that if you're in network hospital is in Omaha, Nebraska, and, you know, that's an hour drive. So, you know, it can be a little challenge to travel. So there's just some limited plan coverages in certain areas that you have to be aware of. So just always check out what your plan will cover and where, and you'll be left a lot happier having close by good, we've got great hospitals here. We have great doctors here.
We
but
do.
They're really bound by the insurance companies also. So they have to play the game and work with what's covered.
Right.
So we just need to be aware of what they're going to be offering and accepting. And hopefully you'll choose a rural provider because, like I said, we're fortunate to have such good ones here in our area.
Righty. So, recap of the points that we need to consider that we want to take away from our conversation. Call Milestone Financial. That's number one. From there,
we are happy to help you.
We're happy to navigate
take the stress
it, yes.
out of your life when it comes to figuring out insurance. We're thrilled to take somebody from that pain point
Yes.
of I don't understand any of this to okay, this makes sense. This is what I'm going to do this year.
Don't let fear, I guess that's the other thing, don't let fear control what you're doing. And just educate yourself. Go online, read, call us. We're happy to guide you. If I don't have the answer, I love to say it like this, I know a guy.
Yeah.
Don't be afraid to reach out. Don't be afraid to call. And just know your deadlines and know what you need to, just know what your medications are, what doctors you see. Just get your stuff and get it all together and then go from there.
So what happens if you don't do anything by December 7th, Denise?
Oh, if you don't
Anything
do
bad?
something by December 7th, you're stuck where you were
That's
last
right.
year.
You just
So
stay on your same plan.
So
you have till December 6th.
you have till December 6th. Yeah, I don't know what
No,
day
don't do that.
December 7th
Don't do
is
that.
this
Don't-
year.
don't wait till the last
Don't wait
minute.
till the last minute.
All right.